I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. Our guest today, we have the pleasure of having Mary Sowers, who is the Executive Director of the NASDDDS organization, which stands for National Association of Developmental Directors Services. I always flub that out, but go ahead and tell us more.
It's not the easiest acronym to always remember, but it's the National Association of State Directors of Developmental Disabilities Services.
Excellent. Thank you so much. All right. Well, Mary, tell us about the organization.
So NASDDDS is a membership organization that serves the 50 states, the District of Columbia, and hopefully soon the territories. We're working hard to provide them some supports. So in each of the states in the district where there's an agency that supports individuals with intellectual and developmental disabilities to have good lives, we support those directors and all of their staff. And so we are a membership association, but I like to think we're much more than that too, because we really provide just an on-call approach to support the directors with any problems that they might have or challenges they're facing, and most importantly, to serve as a linkage. So we are very big proponents of peer-to-peer learning, and so making sure that we can help directors find someone who might be wrestling with or succeeding on the other end of a particular challenge. So that's an area we like to grow.
I know for me that's always been valuable, is to find peers that are struggling with some similar things. Would you say that that's one of the biggest or the best parts of the organization?
I think it is. It's definitely the most valuable learning that happens. And we have, we try to do it at multi-levels. So we obviously give opportunities for the directors to interact with one another. But we know that there are emerging leaders all across the country. And so we also try to convene topical areas so that individuals who might work on quality across the states are able to come together and meet one another. It's nice to meet folks that have a similar job as you and to share those issues. We have a group that's around waiver and Medicaid, and so that the folks in the states that work on those issues can come together. We have an emerging group that's really just taken off recently for clinical and medical directors, very much aimed at both trying to boost frankly, how our systems do in supporting the health and well-being of individuals with IDD, both from a medical but also behavioral health perspective.
Well, that's a perfect segue into my area, which is what I'm really passionate about, is the medical care, the availability of having equitable access to competent health care for people with intellectual and developmental disabilities. So it's great to hear that you're convening this group. So can you talk more about that?
Sure. So this is we like to call them affinity groups. So we invite the medical or clinical directors. Most states have someone designated as such or someone that wears that hat some of the time. And so we convene that group every other month. It's chaired by 3 of our members representing the state of Michigan, California, and Pennsylvania, who help us shape the agendas for that. And it's really just an opportunity to come together around particular issues. We've also recently been able to forge partnerships with other organizations. So the National Association of State Mental Health Program Directors, we had a joint call with their clinical teams too, so that our clinical members are able to interact with their clinical directors. And then we're increasingly aiming to get more involved with FAADM, the American Academy of Dental or Developmental Medicine and Dentistry, to try to make sure that we're linking in with their expertise as well.
That's great to hear. I've been a member of that organization for, over 10 years now. And love the group and love the mission, and I'm really in support of that. So maybe we'll be doing some things together. That would be exciting.
Fantastic. One other area that we are have been working with our members on is it may surprise some folks or not that much, but our members are because our service delivery systems have evolved in such a way that we didn't want to over-medicalize the supports and services that individuals received. Perhaps that pendulum swung so far that we haven't tended well to the health and wellness. And so we're really trying to encourage relationship building with Medicaid and public health to make sure that we're bringing those lenses in, and that we're making sure that individuals are getting the medical care and preventive treatments that they need regularly. But we also know that many individuals, as adults with disabilities, become eligible for both Medicare and Medicaid. And so we're embarking on some work so that our members can be better equipped to support individuals both during that transition period of dual eligibility, but also longer term, really leveraging all of the medical supports and services that are available through both of those programs to really maximally support them.
This is really exciting for me, I just have to say. And I want to go back to one of the things that you said about, over-medicalizing and being concerned about that. And that's something that we've talked about here in the program before, about, the term the medical model and seeing the people with disabilities or having a disability as something that needs to be fixed. And that is not the current way we see things, which certain, and it's moved towards a social model. But the big thing about that is that sometimes there's still a carryover that when you start talking about healthcare, people still have, it's the medical model. But no, that's not what we're talking about. Right. We're talking about improving the supports and services network and growing the competency of healthcare, of the healthcare field, so that people with intellectual and developmental disabilities can have equal access or an equitable access to the same level of healthcare that anyone else does. And I love that the organization is working towards that as well.
It's exactly right. And I think intuitively we've known that we needed to tend more here for some time, but it never became clear than during COVID, when the comorbidities of individuals with IDD resulted in very terrible outcomes for folks with IDD. And it just, I think, really created a wake-up call for our organization to make sure that we are encouraging and showing the way for states that you can do both. It's not a dichotomy. You can both support individuals to have good lives in the community without an overly medical approach, but at the same time, not lose sight of the importance of health for all of us.
And it really speaks to person-centered supports and
Absolutely.
Services and balancing what's important for people with what's important to people.
Precisely.
And it is always finding that balance, and that balance may be different for different people.
Exactly.
Yeah.
So we're also increasingly cognizant that the direct support workforce that support many individuals to have good lives in their communities also can benefit from health coaching and wellness education. And so we're hoping that as states are thinking more about this intentionally, that they're also, as perhaps a happy additional impact, helping individuals who are direct support workers also gain some health acumen and support in that work too.
That's something that other directors that I've talked with, speaking of that, we're coming to you from one of the annual conferences of the NASDDDS organization here in Portland, and I've had the opportunity to talk with some of the state directors, and that's one of the things that I've heard, which is really great, is not only are helping organizations to support people with intellectual and developmental disabilities, but to support their employees as well, and the importance of that, and how valuable that is to helping employees feel a part of what, feel that they're a part of what's happening, which can help with or help reduce workforce turnover, right? People are more satisfied with their jobs.
Exactly. And the truth is we don't have a service delivery system without providers and direct support professionals. And so as we sort of think about forging partnerships and, thinking about the theme of our conference as being bridges, we've got to really make sure that the bridges are strong throughout the service delivery system on these issues, and certainly importantly, but just to make sure that we are supporting the direct support workforce as well as we can. Because not only the workers that we have supporting folks today, but hopefully we are actually building a career path that people want. And so really just being mindful of that is so very important.
Absolutely. So that's wonderful things about the organization, but I want to talk about Mary for just a minute. How did you come into this field?
So it's funny. It won't surprise, probably everyone has said something similar, but I served as a direct support professional in college, and so fell in love with the field a bit. I had a policy background, worked on Capitol Hill, but then went to do advocacy for a local nonprofit supporting individuals with IDD, and have since stayed in the realm. So I worked for the state of Maryland Developmental Disabilities Administration for several years, and then went to CMS, where I was in the Disabled and Elderly Health Programs Group, both as the Division Director over Long-Term Services and Supports and the Long-Term Services and Supports Policy Advisor. And it's just given me, I love Medicaid. I think Medicaid is a terrific program that supports millions of individuals with IDD to have good lives. But I'd always had an affinity for the NASDDDS because the seminal work that it does in states. And in addition to supporting members, we like to think that we are also promoting those good practices that can help the field evolve. So Nancy Thaler, who many will know, is a mentor, and I'm indebted to her for her leadership and mentorship over the years. And so when she invited me to join NASDDDS, I was eager to do so.
Well, that story speaks so well to one of the reasons we're doing this podcast is to help people see this field as a viable career opportunity, including as a direct support professional. And you're right, so many people have started as direct support professionals, and I think it's a great testimony to the fact that there are so many opportunities in this field, and at whatever level that you come in, there's still so many things that you can do in support of other people.
It's truly, and there's so, like you said, there's so many ways you can go. I mean, there's so many areas of affinity that you can really pursue and grow, and so I'm really hopeful that we'll be able to make that case moving forward to attract more and more talent into the field. Well, one of the things I like to do, Mary, is something called 3 in 3. So it's 3 things in 3 minutes, and you don't have to hold to the 3 minutes. But 3 tips, 3 words of wisdom, 3 pieces of advice that you think listeners could benefit from hearing related to improving the world of supports and services, or health and wellness, or just life in general for people with intellectual and developmental disabilities. And this has been a theme here at the conference, I think, but making sure that that we're engaging with people that we're trying to support to make sure that we're doing it right. I think in the absence of having the voices of people with lived experience informing the work, we aren't going to hit the mark. So that's
we
number one.
We might think we know what's best for someone else, right? But unless we ask people, we may be providing a cool service, but it might not be the one that they really are looking for. So that their voice is essential. Yes, and to make sure that you're seeing them as partners and really engaging them throughout, not sort of asking for a snippet of information at a point when you have to submit something for public comment, but instead that build that partnership, really build relationships with individuals and families, and understand what that's a great day-to-day great lives. Number one for sure. Yeah. Number 2 is I think we think about the silos in which we operate, and it's easy to become complacent with the silo activities, but our world doesn't exist in a silo. And so really making sure that you've got relationships and cultivating constantly relationships with other state agencies, with your community partners, just really making sure that relationship piece is front and center, because in order to support individuals, especially those who have the most complex medical conditions or the most complex behavioral support needs, it's going to take more than your particular agency in solving the issues for them. And so really wanting to make sure that you've got those relationships cultivated and nurtured at the time when you need to come together around a particular person. Building those bridges, which is, again, the theme of the conference, right? Yes. Yeah. How about our number 3? The third one, and this will show my bias toward the Medicaid program, but really deeply understanding the program so that you can use its maximum flexibility. And so I think that goes for directors of developmental disability services, but also the partners in the community who are active in advocating for change. Really understanding those flexibilities and what's possible there becomes so very important. Those are 3 great things to end with, I would say. Mary, first, thank you for taking the time out of your busy schedule to talk with me today. My pleasure. But most importantly, thank you so much for the incredible work that you're doing in this field, the leadership that you're providing, and keep on keeping on for sure. Thank you, and thank you for doing this. It's so very important.